Hi, I'm Christopher King. I'm the Associate Medical Director of the Advanced Lung Disease and Transplant Program at Inova Fairfax Hospital in Falls Church, Virginia. And in this video, we'll be discussing one of the treatment pathways in pulmonary hypertension, the endothelin pathway. But first, I'd like to just talk about why increased pulmonary pressures are important and how they affect the body. So when you have increases in the pulmonary pressures, it affects the right side of your heart. The right side of your heart is different than the left side of your heart. The left side of your heart is a large muscular tube, and it's able to mount these very high pressures like we're used to seeing when you take your blood pressure at the doctor's office. The right side of your heart is not built to deal with pressures that are high like that. It's a thin-walled, sort of elegant structure that actually sits in the front of your heart. And in a normal state, it moves in this sort of wave. And so when it faces increased pressure, it gets stretched out and it loses the ability to squeeze. And when the right heart can't pump blood effectively through those increased pressures, it leads to decreased filling of the left side of the heart, which can decrease the cardiac output of the heart, making it difficult for you to pump oxygen to your organs and muscles, and can lead to decreased exercise tolerance. And this can be sort of a vicious circle where, the decreases in cardiac output lead to less support for the right side of the heart, which in turn, again, affects the left side of the heart. And so it can be progressive over time. There's a number of different mechanisms that lead to increases in pulmonary hypertension, and we covered that in an earlier video. But in pulmonary arterial hypertension and some other conditions, you can have actually narrowing of the blood vessels and constriction of the blood vessels that leads to these elevations in pulmonary pressure. And so pulmonary hypertension specialists use medications to decrease that vasoconstriction and dilate blood vessels. And we also hope that we can decrease that narrowing with some of the newer medications that we have. And one of those factors that leads to pulmonary vasoconstriction is a substance called endothelin 1. It's one of the key mediators in the development of pulmonary arterial hypertension. And it's something that's present in everyone's body in a normal level, but it's increased in pulmonary arterial hypertension as compared to unaffected individuals. And endothelin is actually the most potent vasoconstrictor that is found in the body. And again, it can cause both vasoconstriction and what we call proliferation, which is abnormal or excessive growth of cells, which can lead to narrowing of the blood vessels and this sort of remodeling of the pulmonary vessels. It can also cause fibrosis and thickening of heart muscle, which can have adverse effects on the right side of the heart. And so in this diagram, you can see endothelial cells, which are sort of the lining cells of blood vessels, produce endothelin 1. There's two receptors it can affect, endothelin receptor A and endothelin receptor B. Endothelin receptor A, when it's bound by endothelin, causes constriction of the smooth muscle in those blood vessels, and it can cause those vessels to narrow down or constrict. Endothelin receptor B actually can release pulmonary vasodilators and can have the opposite effect. And so it seems like it's a good thing to go after receptor A, but not receptor B. But it's a bit of an oversimplification. And so we have medications, all of which are oral. There's three medications: bosentan or Tracleer, ambrisentan, which goes by the brand name Letairis, or macitentan, which the brand name is Opsumit, which can block endothelin receptors. Now, within those drug classes, there's some bosentan and macitentan, which are what we call dual endothelin receptor blockers and bind both endothelin A and B receptors, whereas Letairis tries to selectively block endothelin A. It's unclear which of these mechanisms is better. As I mentioned, it seems intuitive to only block that receptor, which causes the vessels to narrow down or vasoconstrict. But there is some thought that you have to block all of these endothelin receptors, both A and B, to mitigate the adverse effects of these increased endothelin 1 levels. And so it's not clear that any one of these medications is better than the other, but there are some differences in how they work. The mechanisms that lead to pulmonary arterial hypertension are complex. So these are typical medications that are often used in the treatment of pulmonary hypertension. Increased endothelin 1 production is part of the problem in PAH. And so medications that reverse these or combat these increased levels can be an important treatment. And so it's a key component of many pulmonary hypertension regimens, although it's not they have some side effects and they're not always right. So your pulmonary hypertension specialist needs to evaluate your clinical situation to see if this class of medications is something that would be appropriate for your individual treatment regimen. Thanks for your attention. For more information or resources, please visit phassociation.org.